Hello, my name is Dr. Brian Monahan, the attending physician of the United States Congress. I would like to speak with you today regarding an update on the novel 2019 coronavirus, SARS-CoV-2, as of April 6, 2020. The situation is extremely serious and requires your urgent attention to contribute your personal efforts to CDC social distancing guidelines and limit the spread of cases rapidly growing in our nation. There has been a rapid increase in the count of total United States cases, now approaching greater than 340,000, and an increase in the number of deaths, now approaching greater than 9,700. All 50 states have disease activity. There are many American cities, such as New York City, Detroit, and New Orleans, that are called hot spots for disease activity in the United States at this time. There are also many rural areas where the healthcare system has been completely overwhelmed by cases of coronavirus. All areas of the United States will come to know this disease, some sooner than others. The President has warned us to expect between 100,000 and 240,000 deaths in the United States. The U.S. Surgeon General has warned us this weekend to prepare for the worst week for national tragedy that we will experience in our lifetimes. It is important that you recognize that this COVID-19 coronavirus infection is nothing like the experience of influenza. COVID-19 is highly contagious. It has a very long time from exposure to the development of symptoms. It has a high hospitalization rate, and it has a 10 times or greater case fatality rate compared to influenza. No one is immune, not even partially. The very wide range of severity of illness is increasingly being appreciated. This includes people who have virus with no symptoms, those who shed virus for a day or two before they develop symptoms, those with mild illnesses at home, those with shortness of breath and pneumonia illness in the hospital, and approximately 5% of people who require mechanical ventilation and intensive care unit support. The situation for hospitals and for healthcare workers is dire. We are beginning to see additional features of the infection other than fever, stuffy nose, sore muscles and joints, cough, and chills that also include headache, diarrhea, loss of the ability to smell, and loss of the ability to taste. There are also rare situations of neurologic problems and heart problems. Presently, in our Maryland, Virginia, and Washington, D.C. region, there are greater than 8,000 cases, and 170 people have died. This represents at least 4,100 cases in Maryland, 3,000 cases in Virginia, and 1,000 cases in the District of Columbia. The mayor of the District of Columbia estimates the peak for disease activity to take place in our region sometime in late June. I cannot emphasize enough to you how important it is to follow instructions with regard to social distancing. This will need to be maintained for a long time as our only effective tool to lessen the severity of this disease in the United States. Even a single day of delay in establishing strict adherence to guidelines can dramatically increase the total number of cases the country will experience. It is likely in the future some aspects of our daily life may become more normal, but the present limitations and sacrifices we are now experiencing will be with us until an effective vaccine is available in perhaps 18 to 24 months from now. There is now widespread transmission of many regions of the United States and many communities. The President has instructed the Centers for Disease Control to modify social distancing guidelines to further limit contact among people. This involves prohibition of gatherings greater than 10 people and urging people to respect local government instructions. Recently, an additional CDC strong travel advisory has been issued to individuals from the New York City metropolitan area that must quarantine themselves on arrival at their destination for 14 days if they move to another area. All elective travel is discouraged at this time to limit the spread of disease. Many states have requested a shelter-in-place or safer-at-home instructions to their citizens that sometimes include a prohibition on gatherings of any size. Please consult with your state governor's order to learn of additional limitations where individuals may leave their home under infrequent and specific circumstances only. Many hospitals have diminished their numbers of other patients to make room for the surge of coronavirus patients who need care. This has caused hardship to individuals seeking access to regular health services or elective medical and dental procedures. You may also have noticed that most physician offices have now switched to a telemedicine type service where you speak with your doctor on your iPhone and they provide a diagnosis and therapy as appropriate. Our health units here at the Capitol have adopted a similar approach where an individual will call into the health unit prior to entering for instructions as to what they should do to go for care. Each of our health units has a sign on the door with a telephone number to call. These guidelines, essential for our individual efforts to limit the spread of coronavirus, are known collectively as social distancing. I would ask you to review the Centers for Disease Control website that has meaningful instructions on making your office and workplace less likely to spread virus and other helpful suggestions. I would encourage you to look at this site frequently as a reliable site for information, contrary to the rapidly expanding misinformation or harmful suggestions arising on many social media and internet sites. Many people have questions regarding wearing masks. The mask is often used to limit your ability to spread disease by spreading droplets from your nose or mouth during a cough, sneeze, or speaking that contain virus. The purpose of an individual wearing a mask is not to protect themselves from getting the infection, but rather to protect others in their environment from being exposed to virus that may leave their mouth or nose. While there is international acceptance of mask wear by all people when they are in public, there has been some debate about this in the United States. The Centers for Disease Control has modified their instructions for voluntary compliance by all Americans to wear a face covering anytime they are outside or in public and cannot maintain the essential 6-foot social distancing standard. You do not need to wear a face covering if you are alone in your workplace or if you can maintain the 6-foot separation between people. You do not need to wear a face covering in your home. There is significant concern that should people start to wear these face coverings, they will not be adherent to the social distancing requirements that are absolutely essential at this time, or that the search for face coverings may deplete the masks for medical treatment facilities that are already in short supply. At the Capitol, face cover wearing is a voluntary activity in conjunction with CDC guidelines. If you can maintain the 6-foot separation between people required by guidelines, you do not need to wear a face cover. If you cannot maintain the guidelines, you should wear a face cover. You do not need to wear a face cover in your home. Should surgical masks be available as specified in my recent video, you may wear a surgical mask. Under no circumstances should you wear an N95 respirator mask, as these are reserved for high-risk medical treatment situations. My recent video reviews these types of masks in more detail. I will now demonstrate the homemade face covers recommended by CDC that a person could consider wearing that were not available for my last video. I will now demonstrate the simple fabric mask. You've seen this mask discussed in the White House press conferences as a mask formed from a simple folded scarf. As you can see, I've taken a scarf material here and folded it over in roughly thirds. I've placed a rubber band at either end of the scarf. You can see the rubber band here and a rubber band here. Then take the ends of the mask and fold it over, such as this, and pull the rubber bands over to the side. Remove your glasses is a key step in mask application. Bring the mask up to your face, place the rubber elastic bands around your ears, then reapply your glasses, and you're done. And you have a generally effective face cover that's made from a simple folded scarf. It's comfortable to wear, it's easy to speak, and you can see it fits quite well. There's one example of a simple face covering made from a folded scarf and 2 elastic bands. I'll now take the glasses off and remove the mask and show you another type of mask, face covering that you can do. The next face covering is one that I made in my home last night, which just starts off as a shopping bag. You've all seen these type of bags. It's a polyester material that you get from the supermarket to put your groceries in and reuse it from time to time. It has the advantage that it has integrated straps in the handle of the bag that you will save to form the ties that go around your face. It's important that the bag have a logo on it so you can differentiate the inside versus the outside of the mask after you complete its fabrication. I'll now show you the finished mask. This is the mask that I finished off from that a black shopping bag, just like the one I showed you a moment ago. You can see that it has the logo on the inside here that differentiates the inside of the mask from the outside. This mask was fabricated by my wife in about 2 hours of work using a sewing machine. If you don't have a sewing machine, it's a difficult task. The mask is applied by taking your glasses off, taking the upper strap, bringing it up to your face, and you can use a piece of Velcro that I obtained from a leftover computer cable that had a Velcro tie on it. Attach the lower strap, and then refashion it and put your glasses back on. This type of mask has been made from a shopping bag. As you can see, it fits quite well. I've added an additional step underneath the glasses here to insert a pipe cleaner into one of the seams so that the edge of the glasses will sit over the mask so as to avoid fogging the mask every time I exhaled. I could wear this mask for quite a bit of time, and it's generally helpful at preventing any viral particles from my nose or mouth from leaving as I'm speaking, or should I cough or sneeze. Once again, the value of this mask is not to protect the wearer against infection, but rather to reduce the spread of any viral particles that would leave your nose or your mouth during the act of speaking or during coughing or sneezing. Thank you very much for your attention. I'll now remove the mask. Remove the glasses first. Top Velcro strap, bottom Velcro strap, and the mask is removed. An additional feature of these face coverings is that you'll have to make several of them, and that this one should be laundered at the end of the day by tossing it into the washing machine. It should be also replaced should it become visibly soiled or wet. Once again, this is the simple mask that's made from a shopping bag.